I'm the Director of Public Health and Sanitation in the State Department for Public Health and Professional Standards, which is one of the state departments under the Ministry of Health. Leadership that is about guiding systems, people and policies to protect and improve the health of the population. But it also requires vision, evidence-based decision-making, and the ability to respond effectively to emerging challenges, for example, infectious diseases, outbreaks, but also the growing burden of communicable diseases. A strong leadership in public health also means fostering collaboration, because Ministry of Health cannot work in isolation, and that collaboration is across sectors, but also investment in prevention and prioritization of equity to ensure that no community is left behind, with the ultimate aim to ensure that public health leadership builds resilient health systems that can anticipate, withstand, and recover from health threats while promoting the well-being of the population. The issue of the non-communicable diseases, for example, hypertension, diabetes. But recently, there have been a lot of cases of cancer outbreaks in the community. The other issue is the emerging diseases. I remember recently, for the first time, we had COVID in the country a few years ago, which was basically a pandemic that affected all the countries. But we are talking of other key issues like antimicrobial resistance, where the antibiotics that used to treat common illnesses are no longer effective, and the efficacy has gone down because of resistance. But the other biggest challenge also is on the issue of health worker shortages, because as much as our training institutions are producing healthcare workers, we still have shortages in our health facilities, and that tends to affect service delivery, but also access to healthcare by the population. This summit comes at a critical time when the world, and particularly Kenya, is redefining its approach to public health, like I did mention. So this summit also will provide a moment or opportunity for renewed commitment to universal health coverage and the health system strengthening. But also the summit will provide a platform to align priorities, share innovations, and build a unified vision for the future of public health in Kenya. We expect to have public health leaders right from the top leadership of the Ministry of Health, but also the health sector as a whole are convening to be able to chart the way forward as far as public health is concerned. But also the most important legacy here is to ensure strengthened leadership, enhanced collaboration, but also a shared national vision for public health. We are talking of this summit being able to serve as a catalyst for building a new generation of public health leaders equipped to navigate the complex challenges that we have already mentioned. It will establish a sustained platform for dialogue, innovation, and accountability, ensuring that public health remains at the center of national development.